This is a really strange one. Callous disregard and laughter in public. And often I've seen clients say, oh, it doesn't matter, my dog's dead, I'll get another dog. Oh, it doesn't matter, I was expecting the dog to die. Ha ha ha, he's gone now, well, at least I can go out for yum cha. So sometimes people put on like a show, it's like dressing up for a concert, but you know inwardly they're devastated. This is just a show for other people around them. Sorry, that's a Chinese. Some people go into denial. Now this may seem strange, but I'm going to tell you a story about a little dog that I and other people in our North Point hospital looked after for several years. The little dog was called Bobo. It's a very common name for dogs in Hong Kong. Little Bobo was a little Shih Tzu, and he developed diabetes. If you've heard of diabetes, you know the body can't control the levels, the blood levels of glucose. And it's controlled by a drug called insulin that's released from the pancreas gland. Anyway, little Bobo was also a little devil in disguise because he did not like his mum or his dad giving him his insulin injection. And he had to get insulin injections twice every day. When he came along to our clinic, he walked in the door, he was put on our table, he got the injection, and it was like nothing had happened. Everybody loved him, everybody knew him. He liked coming in, sometimes he got some treats, he certainly got hugs and a lot of attention. He never even knew he got the injection from our staff. So for 2 years, Bobo came to our clinic every morning and every evening. One day, the phone rang, and the lady owner in the house was crying. It was early in the morning, and she had got up, and Bobo was dead. Now, it was unexpected. Even though everybody knew Bobo had diabetes, everybody had told her and her husband that the life expectancy was not as long as a normal life. So every month, every day sometimes was a plus, was a bonus. But Bobo had 2 years, and he was 16, I think. He had 2 years as a diabetic, and suddenly he died. Everything was processed that we're going on to see after this about how we deal with dead animals in veterinary practices. But about 6 weeks later, the husband of the lady owners of Bobo asked if he could see me. And he said, Dr. Pauline, he said, I've got a problem. He said, every night, my wife puts down food and water for Bobo. Every morning, she takes the food and water, she puts it in the rubbish bin, and she puts out fresh food and water for Bobo. I don't know what to do. What should I do? So I don't know if anybody's any suggestions here, but what I told him to do was just let her do it. Just let her do it. She is processing Bobo's death. And at that stage, she was in denial. Even though she found Bobo, even though she'd been looking after him, even though she knew he was a little devil for his insulin injections, and she loved him dearly, she was in denial that he had actually died. So he did. That's exactly what he did. He just left her, and about a month later, he came in to see me again, and he said, Dr. Pauline, she stopped putting out the food every morning and every night. And by that stage, she had begun to calmly accept the fact that Bobo was no longer running around in their house. And it took her 3 months after his death to stop every day, morning and night, feeding her dog. And there's nothing wrong with this. It's just people respond to these situations in different ways. After you accept the fact that your animal is dead, then usually there's a thankfulness, a gratitude that no longer is the pain there, no longer is there anything to worry about. You're grateful. You're grateful for the life of your pet. You're grateful for the time that you've spent with your pet. You're grateful for the love and the care that they've given you, as well as you giving them. And sometimes, though, people don't go through the phases in that order. And it has been noticed that people can sometimes shout and scream, cry. People will shout sometimes at the people in the hospital. If you're a veterinary assistant, people will get annoyed with you. They certainly get annoyed with the vet. I have another story to tell you about a dog called a whippet dog. A whippet's one of these sleek dogs. There's not many in Hong Kong, but there are a few nowadays. But this dog had been imported into Hong Kong. It was almost 17 years old. It had a heart problem for 5 years. Every time the owner, he traveled a lot. It was just a single male owner. Every time he traveled, in the last 2 years of the dog's life, the dog came to our hospital and stayed in our hospital. So we made sure the medications were given correctly and at the right time of day. The dog also loved coming to our hospital. I think in these situations, we actually spoil the pets. They like coming in, they get treats, they get special attention. But anyway, this time, the whippet heart decided it was enough. And it wasn't on the first day in the hospital, and it wasn't on the last day. It was just along the period. I think he was in for 5 or 6 days. Suddenly, the staff noticed that the dog was lying down. He was very blue in color. They brought him out the cage, and often he actually wasn't in a cage, this dog, because he was quite happy just lying at the feet of the reception staff or being with the veterinary assistants when they're having lunch, because he liked his little treats. But anyway, he was lying in his cage at this stage, and he was blue and there was no breathing. What happened then was a series of about an hour for staff trying to resuscitate him, bring his heart back, bring his breathing back. Tubes were put over his throat to give him oxygen. But at the end of the day, about 1 hour later, this little whippet was pronounced dead. Nobody could bring him back to life. At 17 years of age, his heart had just decided enough was enough. And it was actually quite, I was there at the time, and it was actually a bit of a relief for all staff too when he did pass away, because he passed away very quickly. 1 hour. It's a very short time. What happened next, though, was the first time in my life I have ever seen a pet parent. When he came, he was out of Hong Kong. He came back 2 days later. He came into the hospital and he started shouting, screaming. He had not had time to process the fact that his beloved dog had died when he was away. He was thumping the wall. He was kicking the wall. He was so emotional. He was wailing and shouting. And actually, nobody knew what to do. Nobody could comfort him. Nobody could help him. He was just getting his emotions out. He was not blaming anybody. He was not shouting at the vets. He was not shouting at the staff. He was just so upset that his dog had passed away and he couldn't see him again. And it was certainly quite a humbling experience, watching the pet parent being so devastated that he's lost his pet. After situations like that, sometimes people go into depression. the next number 11 on my list. And sometimes people need counseling. They need help. They need psychological help to get over the death of a pet. And unless you are a pet parent, other people find it very strange. Why are you so upset? It's just a dog or it's just a cat. So it's very, very difficult sometimes for people to get over being depressed about losing a pet. Sometimes people are just uncomfortable. They don't want to talk about the fact that their dog is no longer there. You meet them and you might say, how, and then they don't want to even talk to you, especially if you're the vet that was looking after the animal. They would rather not talk about it than talk. Okay, now, hopefully you all understand that, the different emotions that people go through. And we're going to do a little bit more of that after these poems. Now, this slide and the next slide is actually, we don't know who wrote it, but it's very, very commonly referred to now when we talk about death. We talk about the rainbow bridge. And this is the bridge between life and death, the passing over bridge. I'm going to get everybody to read this poem. And what I'm going to do, I'm going to change channels and we're going to go into Cantonese because I'd like everybody to read slide number 13, the next slide. This is in Chinese, and Alan here, who's with me, he's helping me with the Zooms and everything. He's going to read it in Cantonese, and I'd like you all to read it to yourselves as he does that. Okay.
彩虹橋有一座橋連接了天堂和人間，因為它繽紛嘅色彩，於是被稱作彩虹橋。就在彩虹橋這端有個地方，有着一大片草原，以及長滿茂盛綠草嘅幽靈和山谷。當一隻被人所愛嘅寵物死後，就會來到這個地方。這裏有充足嘅食物、水和溫暖嘅春天。隨着時間慢慢流逝，當我們只能在夢中回憶他們嘅同時，所有年老病痛嘅動物在這裏恢復健康和活力。這些受了傷或者殘廢嘅動物會在這裏變得完整和強壯。他們整天陪伴着彼此遊戲玩耍。這些動物們過着快樂而滿足嘅生活，只有一件小事除外，他們思念着對他們來說非常特別的某個人，而那人必須遺忘他們。他們總是在一起奔跑玩耍，但是有一天他們其中一個會忽然停下遊戲，明亮眼睛專注地注視着遠方，身體熱切地顫抖着，然後突然從玩伴群中跑開，雙腿帶着他飛奔過綠草地，越跑越快，越跑越快。那時因為他看見你了。當你和你特別嘅朋友相遇，你們緊緊抱着一起，浸沉在重逢嘅喜悅中，再也不會分開。快樂嘅吻像雨點一般落在你的臉上，你的手再次撫摸着他可愛嘅小腦袋，你再度深深地注視他忠實的雙眼。他在你生活中消失了那麼久，卻從未在你心中缺席。然後你們一起跨越彩虹橋，永遠永遠不再分開。